are there reasons as to why we could recommend it to our patients as doctors, even regardless of their age? Yes, there are. And this is totally from my opinion. I've not read this from anything. I'm just retrieving it from my own experience. Okay. So this should not be used to guide medical decisions 100%. You should also consult with your gynecologist. So there are things that make us also like counsel patients on this as a method. So for example, number one, if you have like so many children, and we fear that another extra pregnancy could strain the uterus and lead to a uterine rupture and put your life and that of the other child in danger, then we would recommend it. Then things like cesarean section scars. If you have had like 3 cesarean section scars and you're sure that you have achieved your family size and you're sober about it, then we could recommend it, because we also don't want you to get pregnant and accidentally go into labor when you have like 3 cesarean section scars. So because chances of rupture, and rupture can lead to loss of life, etc. So this is something that I would highly consider. I wouldn't mind, okay? But again, having 3-4 previous cesarean section scars should not limit you to undergo bilateral tubal ligation. You can also choose other methods like the coil, the Mirena, the ICD, the Mirena, etc., the implants, and get good care in subsequent pregnancies. Because if you know you have like a good transport system to the hospital, you're being followed up personally by your gynecologist, and you do not wait for labor to set in, or you have a very quick transport system from your house to the hospital in case of any labor, then I think then I would to take BTL. Then the other things is like the medical conditions that are incompatible with pregnancies. Right? So as much as we always counsel our patients that if, for example, and things like heart conditions, not all heart conditions, right? Heart conditions just need to be followed up properly, get care of your gynecologist ahead of time before the pregnancy, do a preconception care. But there are other very severe cardiac issues, very, very severe, that can lead to death with pregnancy. Okay, so and unfortunately we will normally catch most of those patients during pregnancy, in their first pregnancies, and then we follow them with the fingers crossed, and we advise them that if you get pregnant again, chances are that you could lose your life. Yeah. So and not all medical conditions, not all cardiac conditions, they're just like a very, very rare other end of the spectrum conditions. So for those patients, we will really, really advise and counsel them on taking tubal ligation if they survive the first pregnancy. Okay, because we'll tell them that as much as we're all human. So it can always be tempting, because you survived the first one, then you think that then I can as well survive the second one. So yeah. Then other medical conditions the other medical conditions, like for example, patients who have undergone renal transplant and they're not stable yet with their kidneys, then we would advise, if they have like a good number of children, or they're okay, they have at least 1 child, 2 children, depending on it varies from patient to patient, then we would probably advise them on this. And then there are other obstetric is pregnancy related illnesses that come only in pregnancy. So the people who get like very bad hypertension in pregnancy, that is very, what we call toxemia of pregnancy. It's very toxic, yeah? So it can lead, I've seen patients go for dialysis because of hypertension in pregnancy. I've seen patients have temporary blindness because of this, get mini strokes and strokes. I've seen patients who have almost lost their lives. I've seen patients lose their lives due to some of these pregnancy-related complications. So if you get one, then okay, then it's recurred in your second, third pregnancy, then we'll advise you to undergo a permanent method like tubal ligation, because we wouldn't want you to get through the same danger of dialysis, etc., in a subsequent pregnancy and most likely lose your life. And then I think those are the main reasons why I would advise a patient to undergo tubal ligation. And or if, for example, you had a ruptured uterus and you have a good family size, then we'll advise you that in the other pregnancy, the labor could be a bit complicated if you don't come to hospital for a planned cesarean section. So we'll advise you to, during the repair of the ruptured uterus, to just undergo a tubal ligation. Okay. Then, so patients need to also know that they should not rely on friends' influence, or they should not use their financial status to make a decision like this. So you cannot say, because I'm broke today, that I should just have this one child and undergo tubal ligation. You don't want to regret in the future. Being broke is not permanent, yeah? And also I think you should also consider the number of children that you have. I think we've talked about this. So yeah, that's I think that's it about tubal ligation. This is purely from my personal experiences. And then let's go to the male sterilization. So the male sterilization is called vasectomy. It's a 20-minute office procedure. You don't need to go to theater. You can go to a mini theater, and so it's done. It's not done under anesthesia. You don't need to be asleep or under anesthesia to get this done. It can be done under local anesthesia. So we just inject at the areas, at the pubis, below the pubis. What do you call this? The pubic area, and so we'll be able to palpate the vas deferens, because they're like hard strings, hard tubes. Then we cut them. It's an office procedure, as I said, not very popular among most Kenyan men. I do not know why. So because especially if your wife, if for example your wife is undergoing so many complications with their family planning methods, why wouldn't you just help your wife? Get the procedure done on behalf of your wife. Be the one who's taking the family planning in the family. Get the vasectomy done. I think it's very popular in the West. And a few Kenyans, I've seen I think in my practice, I've seen 5 men who had undergone vasectomy. So, and it's good because, if your wife, for example, has all these life-threatening conditions, maybe she can't go through surgery, or she doesn't need to have all these reasons. You can just be the empowered man who takes the family planning in the family into their hands. So yeah, I think men who undergo through vasectomy are knowledge-wise empowered men. It's a good method. And so one thing to know about vasectomy is that the sterility from it is not usually immediate. It's not immediate, okay? So it will take 3 months, or what we call more than 3 months, or approximately 3 months, or 20 ejaculates for you to clear out any swimmers that were already in the system, already in the tubes, okay? So it has a failure rate of less than 1%. So again, it's more than 99% efficient. Then it can also fail if, for example, you partake into coitus too soon after the procedure, and then if, for example, there was again surgical error, if the doctor didn't tie properly, or if didn't tie at all, so surgical error, and then of course it can also recanalize. It can reanastomose. The two parts can reanastomose. Okay, so we normally say once you undergo vasectomy, you need to give it 3 months, use other barrier methods like condoms, etc. And then after that, it's better to go through a semen analysis and check if you're azoospermia is you have 0 sperm count. Then voila, you can partake it as a method after that. Yeah. So, and again, its considerations also match those of females. Do not make it out of emotions. You don't want to regret later. And again, remember, men do not undergo menopause. Okay, so you can do it in your 40s, thinking that you have finished your family life or your reproductive life, and then you marry again at 60, or so. Yeah, be careful, okay? But in case you change your mind in the future, and there are regrets and all, you can undergo IVF. IVF is, you can undergo IVF. So we'll retract your swimmers directly from the testicles, and then put them through an IVF process. IVF is what you call test tube babies, and then implant it into the female's womb. Yeah. And yep, I think that's it. And again, you can also do microsurgeries to repair the tubes. And microsurgeries are usually not very successful because these are very tiny tubes, right? So even as you suture it, you're causing more trauma to the tube. So I think it's a decision that should be made when you're very sober and when you're very sure of what you are doing. Okay. And so yeah, that's it. Before I finish up, I need to decipher some myths that I see some of my patients asking me if tubal ligation can or vasectomy can cause cancers. No, in the contrary, it prevents against if you do a salpingectomy, for example. And so, what are the side effects? No side effects, non-hormonal, nothing. So the only side effects that can happen is maybe you can just the usual surgical complication or anesthesia complications. Okay, surgical and anesthesia complications, and maybe some infection, pain, or some surgical complication, but nothing much. Once you heal and you're good, that's it. You forget about it. You don't need to remember it. You don't need to go through any other family planning. You're as good as what? Yeah. So yep. So and thank you very much for watching. Our next video will be, I think, on implants. Implants, what we commonly call Nor plant, and then after that I'll do depot. Then we continue like that. Okay, so thank you very much. Keep watching, subscribe and share with as many friends as possible, and let me know what you think about these videos. Thank you very much.